We're continuing on with the various types of cancers we see in children, and this lecture will address rhabdomyosarcoma. And this is a soft tissue tumor and the most common that occurs in the pediatric population. And this one can be all over. In the younger kids, it tends to affect the head and neck. Now, I'm going to warn you, some of the pictures that you're going to see of this tumor are not very nice looking, so be careful of who is around you when you're watching this video. Older kids can affect the trunk and the extremities, and we have 4 subtypes, and if they have an embryonic type, it has a better prognosis than the alveolar type. The prognosis is going to be better or best if we can catch this early. This slide shows you the various areas that a rhabdomyosarcoma can develop. And when the tumors get large, they can create a significant deformity and lifelong morbidity. The CBC on these kids is going to be normal because remember, this is soft tissue. This is an orbital tumor, so when you look at the picture on the top left, you can see that this child has a little bit of exophthalmos, almost the sunset eye sign, but it isn't that. It's more of a proptosis because this eye is being pushed forward and then a little bit downward. And you can see how she can't really get the lid to open up completely, so it looks like it's ptosis that's present. And this is because of the cranial nerve that's involved. When you look at the picture on the bottom left, that you wonder, how can parents not have brought that child in earlier? But that is a very ugly tumor. And then the child on the right, you can see how this child has been affected profoundly and cannot open the eyes. And look at this little guy. So he has an embryonic orbital tumor that in June was not even present, and then in November, there it is. Here's a picture of a rhabdo that is affecting the pelvis. So on the bottom right, you can see how this is protruding out of the vagina. And then on the bottom left, we see a big tumor that's arising out of the buttocks. And this little one had the abdominal one. And she's looking pretty darn cute. And unfortunately, this little girl had the alveolar type of rhabdo. So she started out with a bump on her leg one day, and the next week she was at the hospital having biopsies, and she had to have an amputation. She still needs to continue with her chemotherapy. She can't play her sports until everything's done, and she may end up losing that other leg also. The treatment for a rhabdo is chemotherapy to debulk the tumor so that the surgical resection can be done. As you can see in those pictures, some of the surgeries may end up causing an enucleation, which is removal of the eye, an amputation of the limb, and it can lead to other permanent deformities that once the cancer's gone, the kid's still going to have that problem. They follow it with more chemotherapy to make sure that all of the residual cancer cells die. You can see why a disturbed body image is going to be a nursing diagnosis for these kids. You're going to support the child and the family by teaching them about the diagnosis, what our plan is for management, and all the medications that they're going to need to be given while in the hospital and take it home once they go home. Postoperatively, we're going to manage their pain, prevent infection, monitor for bleeding, assess the child for edema, and the kids who end up having abdominal surgery may temporarily have an NG tube in place. Once the gut function has returned, the NG tube will be removed. And this ends the lecture about rhabdomyosarcoma.